Welcome to the Birthing Center at UnityPoint Health Meriter. We're so happy you've chosen to have your baby here. We invite you to take this opportunity to get familiar with our facility before you're here for your birth. Before your stay with us, we recommend that you pre-register on our website. This streamlines the steps you'll need to take when you're admitted to the hospital. Our website is also an excellent resource for information about our updated visitor policy. When you first arrive at the hospital, please use our free valet parking service when available. When valet parking isn't available, you can park in the ramp for free. Your support person can pick up a parking ramp pass at the guest services office in the lobby during business hours. Other visitors can also park in the ramp for a small fee. You can either enter the hospital through the revolving door at the front or through the parking ramp entrance on the second floor. In this tour, we'll be entering through the parking ramp. All right, let's go on a tour of our birthing center. OB Triage is located in the north wing on the second floor, which is the main floor of the hospital. Follow the birth and newborn services signs down the north wing hallway to OB Triage. Based on the evaluation in OB Triage, it may be time to admit you to your private birthing suite in the birthing center. Labor and delivery is located on the fourth floor in the north wing. You will be escorted to your private birthing suite in labor and delivery after being assessed in OB Triage. Upon admission to your birthing suite, the care team will greet you and get you settled. We recommend you bring any items from home that may make your stay feel more comfortable, such as pillows, electronics, books, and anything else you need to relax and pass time. Inside your suite, you'll find your private bathroom with a soaker tub for your relaxation and comfort. Whether you're with friends and family or having some alone time in your suite, if possible, please take the opportunity to read through the childbirth and newborn educational book. This book can be found in the packet of hospital information you receive when you arrive. Your nurse will review your birthing preferences with you and clarify how you prefer to be addressed, encourage you to explain any religious or cultural needs, and discuss your wishes concerning comfort measures, fetal monitoring, and delivery preferences. If you would like to complete a birth preference form, please visit our website at unitypoint.org. Bring a printed copy to the hospital with you to help facilitate discussion. After your baby is born, we recommend holding your baby skin to skin early and often. Your nurse will closely monitor you and your baby in the hours after your baby's birth to make sure there are no complications. Your comfort, care, and health are always our top priority. Baby and self-care education starts immediately following birth and continues until discharge. C-section stands for cesarean birth, which can be planned ahead or unexpectedly needed. Cesarean births are performed in the operating suite located on the fourth floor in labor and delivery. Your nurse will remain by your side if a cesarean birth is needed. A support person can be with you in the operating room. You'll be able to hold your baby as soon as it is safely possible after delivery. It is acceptable to take photographs of your baby. However, video recording is not permitted in the operating suites. After your cesarean birth, you will be transferred to a recovery room where you and your baby will be closely monitored for about 2 hours. Skin-to-skin bonding and feeding are initiated as soon as possible. When medically stable, your nurse will transfer you to a family care center suite located on the 5th and 6th floors of the north wing. Your private suite will have a bed for you, a single sleeper sofa for your support person, and space for your belongings. There is a bassinet on wheels in your room, stocked with baby supplies, but you are welcome to bring your own baby clothes and blankets from home. At UnityPoint Health Meriter, we practice rooming in, meaning your baby stays in the room with you. This practice supports bonding and helps you become familiar with your baby's feeding cues and patterns while learning about safe sleep practices from our expert care team. As a commitment to being designated a baby-friendly hospital, UnityPoint Health Meriter provides an environment that supports breastfeeding while respecting each family's newborn feeding choices and needs. All birthing center nurses receive extensive training in breastfeeding support and are excellent resources. A lactation consultant will also visit you during your stay. Patient safety and privacy are very important to us. Therefore, all persons coming on the unit must check in at the front desk. ID bands are placed on you, your support person, and your baby immediately after birth. Our care team members regularly check that all ID bands match. It is an honor for our team to share this time with you and care for you and your family. The length of time you spend in our birthing center varies based on your needs. Most people who had a vaginal birth stay 1 to 2 days, while those who had a cesarean birth generally stay 3 or 4 days. On your discharge day, please have your baby's car seat in your room, and we'll help ensure it is set up correctly. You'll also want to have comfortable, weather-appropriate clothes for yourself and your baby. In the time leading up to your birth, we encourage you to visit our website to register for our childbirth and parenting classes and groups. Whether you are expecting a baby for the first time, need a refresher, or are seeking support, we have something for you. Whether you plan to deliver your baby here, take part in our classes and groups, or establish care with us, you can consider yourself part of our family too. We look forward to meeting you and welcoming your new baby into your family and ours.